Welcome to Demo 2 on the proximal radioulnar joint with Cassie Bauman, Cindy Petros, Carissa Kolpeck, and Monica Muth. This is an overview of what we will be discussing, with Cindy covering location and bony landmarks, Carissa covering ligament and type of joint, Cassie covering muscles that act on the joint, and Monica covering injuries to the joint.
Here is some information on the bones that make up the proximal radioulnar joint. I will be discussing it in more detail in the next video.
The two structures involved in the PRUJ joint are the ulna and the radius. The articulation occurs at the radial head and the radial notch of the ulna.
Besides the bones of the joint, there is also the ligament of the joint, specifically the annular ligament. It attaches anterior and posterior to the radial notch on the ulna. As you can see, it is the green portion in the picture. It encircles the head and neck of the radius, as shown. This enables the radius to rotate without disturbing the joint capsule. Now that we know the parts of the joint, we're just going to describe what kind of joint it is. So as we've learned, it is a kind of pivot joint or uniaxial synovial joint. This means that it has 1 degree of freedom, which is rotation, as you can see in the picture as it rotates about the longitudinal or vertical axis. So this helps with the movement of pronation and supination. This rotational movement happens in the transverse plane. We will get into more of the motion, but first we will describe the muscles that act on the joint.
Here are a list of the muscles that act on the joint and allow for supination: biceps brachii, supinator, and brachioradialis, which assists with this action. Here are a list of the muscles that act on the joint, allowing for pronation of the forearm. Pronator teres and pronator quadratus are located on the volar aspect of the forearm, and brachioradialis is located on the lateral aspect of the forearm.
The PRUJ is a pivot joint with 1 degree of freedom, and it can perform pronation and supination.
So next we will be talking about injuries to the proximal radioulnar joint. Injuries are not common for this joint because of the joint capsule that it is found in is pretty protective, but you may see a translocation of the PRUJ, and is more often found in children because their elbow may not be as fully developed and as strong as it needs to be. It is associated with an elbow dislocation, and what happens is the radius and the ulna are reversely articulated with the distal humerus, and this could be due to falling on an outstretched arm, also called fouche. So we will now break down the PRUJ translocation into 3 steps. So part A, the fouche contributes to a valgus strain of the elbow. This means that force from the lateral side is impacting the medial structures, and it results in a rupture of our ulnar collateral ligaments. Part B is that this valgus strain may cause a fracture of the radial neck. And then lastly, part C is showing that the radial shaft will now pass between the biceps tendon anteriorly, and then the ulna is going to pass through it posteriorly. This results in a rupture of the annular ligament. And here are our references. We will now show you the PRUJ being used in action. Here the athlete is actively pronating and supinating their forearm as they dribble the basketball inside and out and shooting the layup in a pronated position. The athlete's PRUJ allows supination as the athlete brings the water up to her mouth. She needs to hydrate for her next activity.
Okay, go.
The PRUJ is in pronated position as she swishes the three-pointer. Once again, the PRUJ is in pronated position as the athlete swishes the half quarter. Here it is shown again. The PRUJ allows the athletes to be in pronate position with their forearms as they pass the ball back and forth.
Shoot it.
The PRUJ allows the forearm to be in supinated position as she shoots it over her head and then pronated when she makes it. The PRUJ allows pronation for this trick shot.